Hi guys, welcome to Podcast Med. The topic of discussion in this video is going to be history taking in ophthalmology. The history taking that I am discussing here is from the textbook of A.K. Khurana, and the history taking of ophthalmology is divided mainly into six subheaders, where the six subheaders are demographic details of the patient, chief complaints, history of present illness, history of past illness, family history, and personal history. Coming to the demographic data of the patient, you'll be asking, as usually like the other performers, you'll be asking about name, age, gender, occupation, and religion of the patient. Now, coming to the significance of occupation, which is important here, which is hazards of eye due to occupational hazards. For example, there can be ocular injuries and trauma in case of factory workers, farmers, sports persons, etc. Then there is a chance of computer vision syndrome, more common in IT industries who work mostly with computers and laptops, and the risk of heat cataract in glass factory workers, then the risk of photo-ophthalmitis in case of welders. So that is about the demographic data of the patient. Next, coming to the next subheader, which is chief complaint. In ophthalmology, we have 12 total main complaints that the patient can come with. Those are: first is defective vision, then the watering or discharge from the eye, redness of the eye, asthenopic symptoms. Asthenopic symptoms are the symptoms that the patient experience when he strains his eye muscles so much. For example, headache. It is one of the asthenopic symptom that we see. Then photophobia. Then the next complaint is burning, itching, or foreign body sensation in the eye of the patient. Then pain in the eye. Then deviation of eye, diplopia of eye, black spots in front of the eye. There can be cases in which the patient may experience totally dark spots in front of the eye, which is more common in glaucoma, where there will be particular sight degeneration seen. So then next there is colored halos and distorted vision. These are the 12 chief complaints that the patient can come with. This chief complaints I'll explain in detail in the next video, which will be about symptomatology of eye. And next, coming to the next subheader, the subheader under which we discuss is history of present illness, where the same thing like any other histories, will be asking about mode of onset of the symptom, duration of symptom, progression of symptom, severity of symptom, associated symptoms, other associated symptoms. Other associated small symptoms can be micropsia, macropsia, floaters, metamorphia. These are some other symptoms. All of this can be will be explained in the next video. Then coming to the next subheader, fourth subheader, which is history of past illness or past history. In this, you will be asking about six things, which are similar complaint in the past, similar complaints in the past, similar complaint in the other eye. This is the extra thing that you'll be asking in the ophthalmology history taking. Then the next thing is history of trauma in the past, and next is history of ocular surgery and history of systemic diseases like tuberculosis, syphilis, leprosy, hypertension, diabetes mellitus. The next is history of drug intake and allergies. So similar complaints in the past is important to ask in case here, because in conditions like herpes simplex keratitis, uveitis, recurrent corneal erosions, these there can be recurrence of the complications or symptoms in this case. These are recurrent conditions. Next, similar complaint in the other eye also should be asked, because sometimes conditions like uveitis, senile cataract, retinal detachment can be bilateral. Then history of trauma should be asked, which can lead to delayed Rossetti cataract, retinal detachment. Then history of ocular surgery, history of systemic diseases, history of drug intake and allergies. Then the next subheader is family history. where you will be asking about any inherited ocular disorders in the family. The ocular disorders which can be inherited in ophthalmology or congenital cataract, ptosis, squint, corneal dystrophies, glaucoma, even refractive error. Uh, and you'll be asking about any ocular problems, any other ocular problems in the family, and history of comorbidities run in the family. That is it about family history. Then we're going with personal history. Personal history is almost same in everything: diet, appetite, sleep, bowel and bladder. If the patient had any addictions in the past, all of this should be asked. So here it completes the history taking in ophthalmology. uh, that is it.